Some of our listeners in Great Britain have lately been asking me to come back for another lecture tour. Our friend in the progressive movement in the UK, John Churcher, has been raising the same issue with me, and I'm flattered to be asked, and I would love to go, but there is a problem. When I went in 2015, I just published Progressive Faith and Practice, which is a book about religion. I had a briefcase full of lectures that were as relevant in England as they are in the United States. But my last book, Progressive Conversations, was a compilation of my ethics columns printed in the Springfield News Leader, and the topics addressed in those 100 essays were almost exclusively American problems. And the book we're working on now, America Will Be Great When, is even more specifically tied to exclusively American issues. Great Britain doesn't have overcrowded prisons. They don't have a death penalty. They don't have a radical rejection of immigrants. Europe is not suffering from the income gap that is killing the middle class in the United States. Iceland chose to put their corrupt bankers in prison rather than bailing them out and then allowing them to reward themselves for wrecking the world's economy with multi-million-dollar bonuses. No other Western democracy has anything like the gun problem that we have in the United States. And every Western democracy is done with viewing illness as a business opportunity. Noam Chomsky's most recent book speaks at length about the loss of democracy in America as capitalist interests continue to shift power away from people in favor of corporations. The length and expense of our political campaigns turns the real power of our government over to those who can make the largest contributions. We do have a problem with gullible voters being persuaded to vote against their own best interest, but we have a frighteningly more basic erosion of democracy that just allows money interest to get seats on the cabinet, win positions of bureaucratic authority in the government so that they can deal off the bottom of the deck to themselves without ever even consulting the voters, and oftentimes not even consulting Congress. There are 3 times as many pharmaceutical lobbyists on Capitol Hill as there are elected members of Congress and the Senate. They ghostwrite ridiculous laws that prevent, for example, Medicare cannot negotiate competitively for drug prices. They're not allowed to by law, in spite of the fact that the U.S. government is the largest single buyer of pharmaceutical medications in the world. You can buy American-produced pharmaceuticals in either Canada or Mexico for a fraction of what we pay for them in the United States because the governments of Canada and Mexico are not controlled by pharmaceutical corporations. I appreciate the fact that many of our international listeners stick with us, but I can almost feel you guys gloating over there. As much as you can find people who complain about their national health service in the UK or Canada, you never have seen any nation anywhere in the world go from a universal health care system to the kind of crazy system that we have in the United States. No one looks across our borders and says, we'd like to do more of what they're doing in America. That allows insurance companies, hospitals, private practices, and inflated prescription drug prices to determine who gets treatment and who doesn't. Say what you will about the weaknesses of rationing of services elsewhere, no one looks longingly at the American healthcare system and says this is the ideal we should strive for. Our healthcare industry, particularly the insurance part of it, is still very nervously balanced on a dangerous precipice because the Congress that has voted to repeal the Affordable Care Act more than 60 times is now impotently wanting to actually repeal it, but even though they are indisputably in power with the Congress, the Senate, and the White House, and the Supreme Court for that matter, They just can't seem to agree on how deep to shove the dagger into the heart of middle America. We spend more on our health care in the United States than any other country, and yet we leave millions of people completely out of the system, and a whole lot of us who are in the system still get relatively poor care with inexcusably bad outcomes. Conservatives publicly say that they do not want the government involved in health care, but they know, every elected official knows, or at least they should know, that the American government already pays for more than half of the health care in the country. Of course, most medical expenses occur near the end of life when people are covered by Medicare. But when you add in the Veterans Administration and Medicaid, way more than 50% of every dollar spent in health care in the United States is already government run. The plea for universal health care is not some impossible dream that is unattainable. It's really just a matter of bureaucracy. The system's already in place. It would simply be a matter of changing the age requirements that would cut our out-of-pocket health care expenses immediately. A whole lot of insurance companies, well, their executives at least, would have to learn how to live without multi-million-dollar bonuses every year. But I'm willing to lead a canned food drive to make sure they don't starve to death in their beach vacation homes when we cut back their income. As Bernie Sanders has said, the age of 65 for Medicare eligibility was not handed down by God. We could even stage it in over a period of a few years to give the system time to wean itself off of its addiction to the money that is currently in your bank account. A few months ago, Donald Trump was making excuses for why he had not been able to repeal and replace Obamacare on his first day in office, as he had repeatedly promised to do. He said, "Who knew that health care was so complicated?" Well, in a way, we all knew that it was complicated, but it's really, honestly, only complicated if you insist on protecting the profits of the insurance companies while trying to expand health care and its cost. It's not complicated at all if you can give up on that notion. And it's true enough, Republicans would love to repeal Obamacare and just go back to some kind of Darwinian survival of the fittest approach to health care. But the Democrats have not yet, other than Bernie Sanders, offered any solution that actually addresses the insurance companies. As long as you've got the insurance companies as the gatekeepers of care, it's never going to get cheaper and it's never going to be universal, and the outcomes are never going to be that great. Amen. Go ahead and say that again. Amen. Thanks. Once you can embrace the idea that has already been institutionalized in every other Western democracy, that illness is a problem to be solved, not an opportunity to exploit a person who is in their most vulnerable moment to clean out their bank account. Look, guys, I know I often sound a lot more like a political candidate giving a stump speech than I sound like a pastor delivering a sermon. These are dark days, only defined or especially defined by the fact that we now have to turn to the church to hear a rational perspective on economics and public policy. But those are the days in which we are living. But I do want to say a pastoral word to you today. The oldest of the Gospels in the New Testament is Mark. Mark starts off like a shot. There's no flowery poetry. There's no embarrassing birth myths. Mark tells us that Jesus was baptized, he called some disciples, and went to Capernaum, and went straight to preach at a synagogue. Let's call it a church, because for all intents and purposes, it's the same as a church. So he goes to church, and what happens? Do you remember your Sunday school lessons? The very first thing, as soon as he crosses the threshold of the synagogue, is a demon starts shouting about him being there. Now, I get that this is an ancient document, right? With some seriously out-of-date assumptions. But if you just let Mark tell his story, Jesus goes to this community church, and as soon as he arrives, a demon starts shouting. And when I was first reading that passage seriously in seminary, the first thing that occurred to me was, I wondered how long that demon had been going to that church before Jesus showed up. How many years had that demon comfortably been in attendance, been on the board, went to worship services, and no one ever noticed that it was a demon? And I thoroughly believe, based on my pastoral experience, once Jesus had cast out the demon, the rest of the congregation was sitting around saying, I wonder whatever happened to the Damone family. Why don't they come to our church anymore? Folks, we get comfortable with the evil that we are familiar with, that's always been in the system. I grew up in the segregated South. Monday through Friday, I went to a school with all white kids, and it never even occurred to me that there was a school in my little hometown where black kids went to school. I'd never seen it. I never heard it mentioned. It was off in a neighborhood where I never went. I didn't know that it was there. I worked on the surrounding farms with black kids. I knew their names. And as far as I knew, we were friends. I don't know what they thought. I thought we were friends. It just never occurred to me that they weren't at my school. They weren't in my barbershop. They certainly were not in my Sunday school class. It was not until schools were integrated by the force of the Supreme Court that I had ever known about this demon that I had been living around all of my life. Now, I was in 5th grade when schools were integrated, and maybe I could be excused by youth, but there were just an awful lot of folks who simply accepted that institutionalized demons were just the way the world is. You could say the same thing about indentured servanthood, about slavery, about child labor, about human trafficking, and a host of other truly evil aspects of society. We have come to live with homelessness. We can accept that millions are uninsured. We let young lives go to waste because they cannot pay the tuition, or their parents cannot pay the tuition for them to go to any kind of college. We just accept these demons that sit in the pews of churches all across America without questioning them, because we were born into that world. That's just the way it is. We don't want Walmart to sell slave-produced goods. We don't want our shoes made by children in Korea. We don't want our iPhones made by slaves in China. But we do want everyday discount prices. And we want affordable shoes. And we can't live without the latest technology. We have just always lived in a world that is so full of demons that we can't even see them anymore. We tune out the people that want to change the world because the world at least is stable. It's stable with all of its demons. Now, the point of writing this book for thinking Americans is to make the rest of the world feel smug and self-righteous, quite frankly. I know that a few of my friends around the globe will go ahead and buy the book, and they can say, thank God we don't live in America. But the reason why I will be trying to get myself booked into as many pulpits around the United States as I possibly can over the next few months, if I may say it this way, is I'd like to go around casting out demons. If not to cast them out, at least I want to try to reveal them for what they are. Germany doesn't have tuition-free education because they're better people than we are. Brits don't have universal health care because they're more compassionate than we are. The Nordic states don't have sane drug laws and restorative justice systems because they're more spiritual than they are. They just woke up to their demons before we did. And now it's time for America to turn on the lights, open our eyes, and wake up.
Amen. Thank you for watching our videos. We are entirely dependent on the donations of our listeners and members. We hope that you find this content to be important enough to help us to keep offering these videos to the public at no charge by becoming a regular contributor. Please click on the donate button on our website at www.spfccc.org. Thank you for your support of progressive religious programming.